What should be done when a person with dementia is restless? Wandering, outbursts, strong denial, and irritability can be overwhelming and difficult for the family members who are caring for the person. These restless states are called BPSD and can be difficult for both the person with dementia and the family members caring for them. A method of care that surprisingly improves BPSD is being practiced in Japan. The number of elderly people in Japan continues to increase, and by 2037, the aging rate is expected to reach 33.3%, with 1 out of every 3 people in Japan expected to be 65 or older. It is precisely because Japan is such a country that it is focusing on the spread of science-based care and is making a national effort to implement effective, high-quality care. One of the most notable examples is independent support care. This care is very simple and does not cost much money. It can be performed by family members. Since the symptoms of dementia are the same worldwide, this method of care can be applied to people in any country. We will introduce independent support care, which has evolved uniquely in Japan, and its care methods in this series. Let's get started. To improve the symptoms of restlessness, known as BPSD of dementia, 4 types of care are needed: fluid, meal, defecation, and exercise. At least 1,500 milliliters of fluid per day. Diet of 1,500 calories. Natural defecation without relying on drugs. And walking about 2 kilometers per day or 30 minutes of exercise. If you take care of these physiologically, you will feel better and your restless symptoms will improve remarkably. Let us explain in detail why we need to take care of fluids, meal, defecation, and exercise. When dementia develops, it becomes more difficult to manage one's personal affairs.
Wow!
In particular, it becomes difficult for elderly people to be conscious of their fluids, which affect their physical condition, and to consume the necessary amount every day. Why does dementia make it difficult to manage fluids? As we age, our sensory function declines, making it harder to feel thirst. Furthermore, if you have dementia, you are less conscious and attentive to drinking water because it is hot or because you are concerned about your body, and as a result, you are more likely to become dehydrated. The initial symptom of dehydration is impaired consciousness, which can lead to fogginess and a feeling of fatigue. The patient may feel unsteady on her feet, increasing the risk of falling. Cognitive ability to recognize things also declines, so the inability to understand the situation causes confusion, which leads to increased irritability and anxiety, and if the patient has dementia, he or she becomes restless. Wandering, strong refusal, anger without reason, these symptoms are most likely caused by lack of water. Lack of water also affects eating. A foggy consciousness can lead to loss of appetite and disinterest in eating.
Wow!
Saliva production is reduced, chewing is weakened, and swallowing increases. If food is not swallowed properly and enters the trachea, pneumonia can easily occur. Thus, when there is a lack of fluids, the amount of food eaten is reduced and the body is unable to obtain sufficient energy. Decreased fluids and food intake also affect defecation. What do you think the effect is? Constipation. The lack of adequate water intake reduces the water content in stools, resulting in hard stools. The intestinal environment deteriorates due to a lack of dietary fiber and insufficient bifidobacteria and lactobacilli that regulate the intestinal tract. Constipation is the biggest enemy of people with dementia and is always accompanied by discomfort. It also affects the autonomic nervous system, which becomes agitated and causes restlessness such as wandering, irritability, and strong denial. However, if laxatives are taken without resolving the underlying causes of constipation, such as water and diet, the balance in the body will remain out of balance forever, which is not a good state to be in. Lack of water will cause you to eat less, and if you are even more constipated, you will be reluctant to move. As a result, they become inactive and their physical fitness declines. Going out becomes a chore, and even taking a bath or talking to others may feel like a chore. As a result, the whole body gradually deteriorates and the person may become bedridden, so it is very important to take in enough energy and water, which are the source of activity. So far, we can see that fluids, diet, bowel movements, and exercise are all connected. If we can maintain a good balance between these, it means that we can maintain a calm life. Getting in shape is a way to improve dementia, and it is simple care that can be taken at home. In this article, I explained the 4 chains of care that improve BPSD and restlessness symptoms of dementia: fluids, diet, bowel movements, and exercise. Thank you for watching.